Now, live with Greg Olsen, Director of the New York State Office for the Aging.
Well, good afternoon, everybody. My name is Greg Olsen, and I'm the Director of the New York State Office for Aging. This is a really important show that we have today. They're all important, but September is Sepsis Awareness Month. And in the time that it takes me to introduce today's show, 2 people across the United States will die from sepsis, which also claims an individual every 90 seconds. By the time we finish this show today, 40 people will have died. Older adults are among the most at risk, accounting for 70% of all sepsis cases, but anybody can get sepsis. In fact, sepsis claims the lives of more children daily than cancer. 18 children die every day of sepsis. The information we're going to be providing today is for everyone, individuals of any age, parents, teachers, caregivers, families. We're going to share basic facts about sepsis and the signs and symptoms, and talk about ways your organizations or you as individuals can get engaged in sepsis awareness through the efforts of our nationwide Partnerships for Sepsis and Aging, which is a new national organization that we've founded with some of our partners. Also want to give a shout out to End Sepsis, the legacy of Rory Staunton. Rory's parents founded End Sepsis, the legacy of Rory Staunton, in April of 2012 after Rory's tragic death. Their goal is to ensure that no other child or young adult dies from undetected sepsis. The foundation's mission is threefold: to raise public awareness about sepsis, to promote faster diagnosis, to improve the diagnosis of sepsis through improved communication between parents and medical staff, and implementing rapid treatment protocols. So before we get started, I have an all-star guest list today. So let me start with Tom Heyman, who is the president and CEO of Sepsis Alliance. Tom has led the Sepsis Alliance to consecutive years of growth, including the organization's drive to increase sepsis awareness from 19% to 65%, and the expansion of sepsis.org, sepsis.org, something you want to visit. It's a site serving more than 2 million patients, family members, caregivers, medical professionals every single year. Tom has also led the organization's efforts to launch Sepsis Alliance Clinical Community and Sepsis Alliance Institute, which has trained more than 40,000 health professionals, and Sepsis Alliance Voices, a platform for national and state advocacy. Tom, welcome to the show.
Thank you, Greg. Great to be here.
I should say welcome back to the show, right?
Thanks.
I'm also privileged to have with me Dr. James McDonald, who is the Commissioner of the New York State Department of Health. He is a board certified in pediatrics and preventive medicine. He earned his medical degree from Loyola Stritch School of Medicine in Chicago and completed his pediatric residency in the U.S. Navy, where he served as an officer. He completed his preventive medicine residency from the State University of New York. And prior to being appointed commissioner, he was the Rhode Island Department of Health commissioner. Commissioner, thanks for your service and welcome to the show.
Hey, Greg, I'm glad to be here today. Thank you for covering this important topic.
My pleasure. Third, Al Cardillo. He's the president and CEO of the Home Care Association of New York State, a statewide association comprised of several hundred organizations providing home and community-based health and support services to hundreds of thousands of New Yorkers. HCA's mission is to promote the quality and accessibility of healthcare and support at home. And Al has been a leader in New York State in organizing a very strong coalition to address sepsis, which is how I got involved. So Al, it's great to have you back again, and thanks for being here.
Thanks, Greg.
And last but certainly not least is Becky Prevey. She's the executive director for the Association on Aging in New York, which is a membership organization representing the 59 county-based offices for the aging. The mission of the association is many, but it's to support and engage the capacity of New York's local aging network to promote independence, preserve dignity, and advocate on behalf of aging New Yorkers. Prior to joining that, Becky was a AAA director and Office for Aging director in Franklin County, but she was also an acute care social worker at Alice Hyde Medical Center in Malone, New York. So Becky, welcome back to the show.
Thanks for having me, Greg.
All right, we're going to dive right into this segment. I'm going to start both, and you can decide who wants to answer first, Commissioner McDonald or Tom Heyman, or both of you guys. I'm not embarrassed to say that before I talked to Al Cardillo, I was one of those people that knew the word sepsis, but really didn't know what exactly it was. So can you enlighten us on what is sepsis?
Yeah, maybe, Tom, if you don't mind, I'll go first on that. I tell you, as a physician, I've certainly had patients with sepsis. And just the way I think of it this way is it starts with an infection. So we get a germ in our bloodstream. It's usually a bacteria, but can be a virus or a fungus. And really what happens is, when you have an infection in your bloodstream, then your body responds to that. And it's really an extreme response your body has. And this extreme response really affects every organ in someone's body and causes damage in every organ. And this is what sepsis is. It's a life-threatening problem, much like a heart attack would be life-threatening, or any other thing it's life-threatening. So it's a medical emergency and needs to be attended to right away. Tom, what would you add to that?
Yeah, I would build on that. It's all true, and it could be any type of infection, as you say. And I think that's important for us to remember that the flu is an infection. We have parasitic, we have fungal infections. Now, a bigger problem with climate change. We have viral infections like COVID-19, and of course, we have bacterial infections. And the way we like to talk about it in layman's terms is it's kind of like a bee sting. When you get stung by a bee, it hurts, but it doesn't usually become a problem unless your body has that anaphylactic reaction to the bee sting. Similarly, sepsis can only start with an infection. Infections often don't go bad, but when they go bad, it's usually because they are cascading to that septic reaction that the commissioner referred to.
So, Tom, due to your efforts, and I may have this off by 1% or 2%, but based on your efforts and others to really educate people on not only what sepsis is, but more importantly, or most importantly, the signs and symptoms, I believe that about 63% of individuals have heard the word, but we're still in the teens for individuals that know the signs and symptoms. Can you walk through the signs and symptoms? Because as we enter, flu season, RSV, these are types of things that could mimic the signs and symptoms of sepsis.
Yeah, and I don't know if you have our time mnemonic available, but absolutely, awareness has grown tremendously. When Dr. Carl Flatley lost his daughter Erin in 2002, only 19% of the country had even heard the word before, 19%. And Microsoft didn't even have the word in its dictionary, so it was a spell check error. So we've come a long way, and we do an annual awareness survey. 19 is now 69%. So that's great, but nowhere near stroke or heart attack or things like that. So awareness is not knowledge. You're right. Only about 15% of folks can name the most common symptoms. So we still have a lot of work to do, given that the vast majority, 87% of cases start in the community. We need the public to know the signs and symptoms so they don't think, I'll be okay, I'll tough it out. Very often we find folks who didn't seek care quickly. It's because they didn't know how dangerous sepsis can be.
Yeah, and that's really what happened to, Rory Staunton, right? Had some symptoms, appeared like it could be, nothing major, something else. And then within 24 hours, he passed away. And that's the whole purpose of this, is that we don't have that kind of time, and people need to recognize those signs and symptoms. Tom, the data, how I got involved in this issue was Al showed me the data, and I was stunned and horrified into action. And I think that when you see the data, hopefully everybody's reaction will be the same thing. And just getting that information out on the signs and symptoms is really going to impact these numbers. But can you walk through some of these unbelievable statistics on what sepsis does to people, to healthcare costs, and anything else you want to add?
Yeah, it's quite a lineup of being number one in all the wrong things. And it's a great time to be talking about this during Sepsis Awareness Month, which is the entire month of September. So 1.7 million cases each year. That's a lot. 350,000 perish. Very, very high numerator. So we have a very high mortality rate from this. It's the number one cost of hospital care in the United States. It is the number one cause of death in hospitals. 1 out of 3 people who die in a hospital are dying related to sepsis. It is the number one cause for readmission. So those lucky enough to survive, 40% of them are back within 90 days. Think about the burden on the families, on our healthcare resources and expenses. It is a major public healthcare crisis that has not gotten enough attention.
Yeah, and some others, like for older adults, 65 and over, 13 times increase in hospitalizations, right? Number one reason for amputations, number two for maternal deaths. So it really is an equal opportunity killer. Becky and Al, where do the majority of the sepsis cases originate? Because what I had originally thought could not have been more far off than what the reality is.
Well, Greg, this is so often presented and discussed as a problem in hospitals. And so often that's because when individuals are affected and the symptoms are not recognized early, the individual shows up in the ER generally crashing in need of critical care and support for life. But the fact is that around 87% of sepsis is occurring in home and community. And so it really places an imperative on awareness at that level, but also mechanisms at the community health level for monitoring, screening, detecting, and responding. And I think something very critical with that is it's not just a matter of one-offs. You know, do we train EMS? Do we train physicians? Do we train home health agency nurses and staff? It's really a matter of ensuring that there is connection between all the moving parts of the system. Because if we want to really make sure that we're having an impact, all the different partners who work together, from the home care agency to the physician to EMS transport to ER and internal within the hospital, that everybody is on the same page with regard to the severity of the situation, recognition of symptoms, and treatment.
Now, Becky, you're one of our key partners in this national partnership for sepsis and aging. You know, describe your role. Al talked about some of the partners that he works with, but talk about your network and our sub-partners and why our involvement is so critical, given that 87% of the cases originate in the community.
Well, I think to that point, Greg, you know, we know what's happening in homes and communities. We know that 70% of those cases are actually happening in individuals over the age of 60. Obviously, the offices for the aging throughout the state, our 1,200 partners that actually provide direct services, are in homes and communities of older people on a day in and day out basis. The reason that that's so important, when you look at these statistics, and what's heartbreaking is each of these statistics represents an individual. In the 60 and older population, even if someone survives sepsis, they see a 3-time increase in cognitive impairment, and they typically have 1 to 2 deficits in their activities of daily living, like being able to take a shower independently. So it becomes a lifelong issue. And what we've noted through the network is we have 4.86 million people that are over the age of 60 in the state of New York. We have 4.1 million caregivers. Offices for the aging are touching those individuals on a daily basis. And so this was really something when we learned about these statistics and the impact, we realized we could make a huge impact in identification if we could educate individuals about the signs and symptoms. And one of the things that I think we've done a great job in is our entire network knows how to identify symptoms of a stroke, right? We know facial droop. We know that people, you know, over the age of 50 need their mammograms. We know all these clinical indicators, even though we're non-clinical services. So it was really a no-brainer to make sure that we were working on sepsis as well, because we're going to save lives.
Yeah, I totally agree. And, you know, grandparents, parents, older adults live in families, right? They're not this isolated group. They're interacting with their, you know, children, grandchildren, et cetera. So it's a top-down, bottom-up approach. So we know that older adults, from some of the statistics, are among those most at risk. Can you describe why that is, but then also talk about other groups that are also vulnerable to sepsis?
Yeah, Greg, maybe I could start with answering that question, right? Because, of course, when I think about our older adults, people generally 65 and older, sometimes they have chronic conditions that make them more risk. Sometimes their immune system's not working as well. And sometimes they're interacting with the medical system as more, but there's other risk factors that go along with that. So, and that's one reason why they're at risk. Another groups that I think about, though, is like children. And I want to just talk a little bit about babies in particular. You know, I think about, as a pediatrician, I've attended many births, but sometimes babies are at risk because an infection can transmit from the birthing person to the baby. Other reasons infants are at higher risk is their immune system isn't quite ready yet. So sometimes they're at risk because they haven't been vaccinated against the disease that we prevent as well. But children are at risk as well. One of the things about a child is sometimes they get a cut or a scrape. And, if you think about getting a cut, sometimes whatever you cut with punctures into your skin goes deep. The bacteria on your skin go deep in there. So you might get a staphylococcus infection, a group A streptococcal infection. So children are at risk as well. But then the other group I worry about is people who give birth. You certainly can see this sometimes where after someone's given birth, they're at risk. My own wife had a terrible experience after giving birth and had this infection to go back in the hospital. So there's different groups at different risk for different reasons. But when I think about the signs and symptoms of sepsis, some of them are the same, right? Like it's often fever, confusion, disorientation, heart's beating fast, people feel weak. There might be a localized redness if it's a skin irritation. But those are the things where I think it's important to recognize everybody's at risk, but not everybody's at the same risk.
So, Dr. McDonald, that's a great point. And I think what we always try to do here is two things: provide the information that people need, but then what's the action? So what should somebody do? Again, it's not just in September, it's all year round. But as we are going into cold and flu season, right? And some of these things appear like things we've all had before. And, you'll say, oh, well, I can wait it out 3 or 4 days. What should somebody do if they suspect sepsis?
Yeah. So one of the things, if you're interacting with the healthcare experience, then just bring it up to your physician or healthcare provider. Could this be sepsis? But just say, for example, you're home. This is a common scenario for someone who's older, for example. Maybe someone's 80 years old. They had a fever, didn't think much of it. Then they're getting weaker. Then they're getting confused. And a loved one says, hey, I think you should go to the doctor. And they're like, I've been through this before. I'm not giving you a made up story. This is what happens to people. And sometimes you just have to say, look, we're calling 911. We're going to the doctor. And sometimes it's just helping your loved ones recognize this could be sepsis. This could be a life-threatening experience. And, I think you take it back to other times when you're a parent of a child. I think we're, of course, concerned about our children. But like if you see a wound that's not healing and the child gets a fever and you go to the pediatrician, if you're not getting the answer you want, raise the question, could this be sepsis? Pediatricians and healthcare providers are trained to recognize sepsis and treat sepsis. But there's nothing wrong with bringing your question into an exam room, no matter where you are. Every healthcare provider should welcome your question. That's what we're trained to do. These are just a few examples, but I think one of the things to get back to, make sure you're cleaning yourself after you have a wound. I'll just share this little anecdote with you. I like roses. I like pruning my roses. I wear gloves. One of the things I learned a long time ago is if I don't wear gloves and I'm pruning my roses, I might get one of the thorns in there. But if you get an injury from a thorn or something like that, you got to clean it right away with soap and water and really clean it just to make sure you don't get an infection there. Just a few ideas, Greg. Thank you.
Yeah, and Tom, I know you talk extensively not only about post-sepsis, right, identification, but there's things you can do to prevent infections. Do you want to talk a little bit more about that?
I would love to. If there's no infection, there can be no sepsis. So we just introduced a new tagline, which we've trademarked, which is infection prevention is sepsis prevention. And that includes all the things the commissioner was talking about, cleaning wounds, staying up to date on your recommended vaccinations. All of these things can really help prevent the infection from starting in the first place, which is critical. So a lot of this is about educating the public and our healthcare professionals to have it on their radar. So if someone does come in and not feeling well, and that's kind of the basis for the professional training we've been doing. We've had a training for first responders, who are very often the first one on the scene. First responders carry more than half of sepsis cases to the hospital. So we produced a video that's been seen more than 250,000 times. And, we've trained home health professionals in coordination with the Home Care Association of New York and skilled nursing staff and school nurses. We have a new program there to make sure that they have it on their radar. Camp nurses, OBGYN, oncologists, any healthcare professional is going to encounter sepsis. The key is that they know it when they see it.
Yeah, and before we move into our quick break, so Becky and Al, we talked about awareness of sepsis or lack thereof, people who are unfamiliar with it. There's been a lot of work here that you started, Al, with a really broad coalition. Becky's been engaged in this new organization that we're trying to get awareness out. But But Becky, what are you guys doing to, touch the many partners, whether they be aging or not? And same with you, Al, to further this, because we get bombarded with so much information all the time that these are the types of things you got to keep in front of people, really bi-weekly or monthly, in order to have it kind of stick, like Becky was talking about with identification of stroke, for example, is kind of much more in the mainstream. So, Becky, what do you guys do to keep pushing the messaging out?
We have been doing constant education, webinars, in-person trainings. We work really closely with Al Cardillo and his folks to make sure that this isn't just a one and done, because it has to be more than that to get people to really absorb and understand. And we're training individuals all the way from the volunteers that are delivering home delivered meals, who can knock on a door to drop off a meal and easily identify, are you aware that, you've had an infection? You look a lot worse today. It can be that simple to save a life. And really spreading the word. Initially, when we started this work, at least in the aging services sector, a lot of people said, well, I'm not a clinician. This sounds really clinically intense. And we continually reference the fact that our staff, the provider network that we work with, our home health aides and our home delivered meal program delivery drivers, they easily know the signs and symptoms of a stroke, and they're not clinicians. Sepsis should be the same thing. And that's why the awareness campaign is so incredibly important. The same thing when you look at these statistics that it's killing more kids than cancer. We're all pretty well versed in cancer screenings, and we get them done diligently. Not a lot of people know that sepsis, if caught early, can really be something that you can live through and thrive after. So we're just continuing that message as much as we can.
Al?
Yeah, thank you. And yeah, I just want to reinforce what Becky said. I mean, we've been doing, we really are doing constant training and constant outreach, not only within the home care provider world proper, but also with managed healthcare plans and other community healthcare partners. And I'll just give some examples of some things that would be useful for the audience here to know. So last year, working with the Sepsis Alliance and a grant that we had from the Mother Cabrini Foundation, our team, Taylor Perry, who's our associate director and one of the leaders on this here, worked with Tom's team and created a training module for home care agencies and like agencies to be able to train patients and family caregivers about sepsis. So the module, in the first instance, was a training tool for the agency staff, but then provides them with resources and approaches to help teach and train the families to be very vigilant in their own infection prevention and control. Similarly, we work with the End Sepsis with the Staunton Foundation and the Department of Health with a number of bureaus participating, the Managed Care Bureau, the Maternal Bureau, and others, to put on an educational series related to maternal sepsis and infant sepsis. And in that, we provided not only the educational process, but also the tools that could be used in community maternal settings for screening, early identification, patient education, and so on. So this is like an everyday thing within our association in terms of that outreach and education. And I think very critically, it's focused on really all of the partners that are important to be involved in this effort.
Yeah, and I appreciate what all of you guys are doing. If you're just joining us today, September is Sepsis Awareness Month. We're sharing some critical information to help save your life, a life of somebody else, and to get the word out. We're going to take a real quick break, and we'll be right back. Take some more questions of our panelists here. Take a look at this.
Hi, I'm Molly Ryan, and I'm a communications intern for the New York State Office for the Aging. I am so happy to be on board with this agency, and I'm for sure learning a lot. I have recently learned about the agency's YouTube channel, which has so many resources for older adults and their caregivers. There's a reason they have millions of views. Like and subscribe today.
Thank you, Molly. All right, let's get in. Dr. McDonald, you're the commissioner of the New York State Department of Health. One of your primary missions is to oversee the health, safety, and well-being of all New Yorkers, regardless of age. Are there any programs, regulations that you'd like to highlight that the department is engaged in on this topic?
Yeah, thank you, Greg. Obviously a very important issue here. And I want to point to Rory's regulations, if you don't mind. I printed them off, but I think it's important to understand what a regulation is. A regulation is a law. So when we do a regulation, you have to follow it. And these represent minimum standards. So Rory's regulations really were the genesis of what happened to Rory Starr and his tragic passing. And we owe a lot of debt of gratitude to the family for the help they did with helping create these. But every hospital is required to have protocols. You need to have a protocol so you do the right thing every single time. Protocols are really important because if you know the algorithm, you follow the protocol, you need to still think, but you've got to do these protocols. And every hospital has to have these protocols about early recognition of sepsis, about training when it comes to how to treat sepsis. In other words, it's really important that people be up to date on this because although sepsis is common, it's not something people in hospitals see every single day, but you need to look for it to make sure that you find it. And of course, at the Department of Health, we evaluate hospitals, we regulate hospitals. They have to follow all of our regulations. We also have a lot of data on sepsis. We're the ones who track whether people have sepsis, what were their outcomes, did they survive it? And then we talk about how to prevent it. So that's just a few things the New York State Department of Health does when it comes to addressing sepsis. But I do think Rory's regulations are really an important concept here and something that anybody can find them on the internet. You just Google them, they're right there. Thanks, Greg.
Thank you, Commissioner. Becky and Al, I had asked you earlier what you guys were doing within your vast, not only your own networks, because both of you guys cross over and touch a lot of different partners, and that's really important. So I'm not going to ask you to go through that again. What I would like to ask you, given this is an issue for people of all ages and those with identifiable risks, who are we missing? Who do we need to reach out to? And Tom, you can jump in on this as well.
Well, I think we need to reach out to everybody, which is what we do all the time. I mean, so as something that really can impact anyone of any age, it's important that there's this general awareness and appreciation for this. Within that, of course, there's the higher risk individuals. So, in particular, in the field of home health, the population that we have, the conditions they have, the symptoms and vulnerabilities they have really mirror among the highest risks. For example, urinary tract infections, pneumonia, diabetes, skin integrity breakdown issues, PICC lines and catheters. All those are risk areas for infection and then going on to sepsis. And then when you add the other compromises of age, either older age or young age with it, it's really important, to be, I think, effective in communicating that. But I would just end this by saying it's really important to message and the practitioners, whether we're talking about, and that's across the board, physicians, nurses, physical therapists, occupational therapists, any EMS, folks that are having the patient-facing roles. It's really, really important that everybody be on the same page. And one of the things that we've done with our own criteria is that it really works off Rory's regulations. It works off the protocols that hospitals use. So when our nurses identify this in the community, it's synchronized to what EMTs are using and synchronizes to what's going on in the ER in the hospital.
Thanks. Becky, who are we missing?
I just have to agree with Al. I think that the other component to this, and this goes back to my hospital days, being a self-advocate is incredibly important. Having an individual just know, as Commissioner McDonald said, to say the word, could this be sepsis, could change the treatment algorithm that you go down, because sepsis can turn really bad really quickly. And I think, we're going to continue to saturate any market that will allow us. I will tell you, because of the work that I do, since the age of 5 or 6, my daughter, if anyone in our family had an infection, she would ask, will this turn into sepsis? It's that simple to get this ingrained, not only in the younger population, but in everybody that we serve. And the hope is to make this, as visible as cancer screenings or the signs and symptoms of a stroke, because I think we can get there with the collective work everyone is doing.
Tom?
Yeah, I would say, we can do a better job with immunocompromised communities. Cancer and any other immunosuppressing condition or chronic disease, those folks are at even greater risk. I mean, we know this can happen to seemingly perfectly healthy young people, but those are folks most at risk. And a vast majority of sepsis cases are with people who have some kind of immune compromising condition, not entirely, but often. And on the advocacy point, I would say, we should always bring an advocate or be an advocate for somebody else, because if you are starting the cascade from infection to sepsis, one of the most common symptoms is mental disorientation. So you're not going to be advocating very well for yourself. And in that environment, it's very hard to advocate for yourself even when you're well. It's very intimidating. It's daunting. So to bring as much information as you can and someone who's with you who can advocate for you and say, could this be sepsis? I'd really like you to check. It looks like it according to the data and the information I've seen. Thank you.
So we've formed a new partnership, the TPSA, and I'll let you guys tell me what that is. It's new. We have our second meeting tomorrow. But why don't we start with Tom and Al? What is the Partnership for Sepsis and Aging, and why did it form?
Yeah, I'll start and then let Al go. I think, we really believe that sepsis, and particularly its impact on our aging folks, including myself, needed a national response. So we have lots of great information and resources, and it's all sitting in silos. So how can we form a collaborative, a partnership, so that all that information can be disseminated and shared, and peer-to-peer support and community? We've seen this happen in our Sepsis Alliance Institute with 50,000 healthcare professionals. We provide information and presentations to that community, but that community has become kinetic in itself and sharing information across that community and feeding back to us. And I think the opportunity here is huge for us to get resources that exist currently that can be helpful, that can just get with a flip of a switch disseminated out nationally, but also to seek feedback. What do you need? Do you need these in Spanish? Do you need them in Chinese? What are your needs? How can we help you do a better job? And really in the true form and definition of a partnership, how can we really make this a national campaign? And that's what we're starting, and I'm really proud of the work we've done thus far.
Al?
Well, Greg, really the fact is that you are the model of the National Aging Network and its leadership in sepsis, because the idea is that as you have been a leader in New York State, every state commissioner of aging, if everyone emulated the kind of work and energy and output and commitment that you have into this, how much better would the nation function in its own response, not only at the state Office for Aging level, but right down to the community level with local aging providers and others that are very, very concerned, in service in that population. So, again, I think very candidly, the model is really about you and the idea of trying to replicate Greg Olsen in 50 states of the country.
All right. For those who are watching, that was not pre-planned. I appreciate that feedback, Al. A lot of the folks that we're trying to reach are nationwide, and a lot of the state units like mine are mostly in an HHS structure, so they're connected with their public health, their health departments, and others. So it's much low-hanging fruit. So Becky, how can somebody sign up to be a part of the partnership? And can you just talk very quickly about what's happening tomorrow? Because I would love to invite anybody that's watching this to be able to attend, or at least, go to where they could potentially sign up.
So the easiest, fastest, and simplest way is to go to sepsis.org. Not only does sepsis.org have a mechanism for you to sign up for the webinars that we're hosting, but it also has fact sheets and informations that are easily downloadable. You can join this movement with the click of a button. No money's exchanged. It's just building a coalition to make sure that we're educating community, older individuals, and those at risk. And it's one of those things you can arm yourself with information for you and your family members. And we're reaching out to all of our state leaders who run state trade associations to make sure that we're infiltrating those markets as well. But it's very, very simple. Visit sepsis.org. Very simple and straightforward.
Yeah, and I want to thank Tom and Al for reaching out to Becky and I with this idea, which we jumped on immediately. And Tom, you and your staff have been amazing in creating and building out your website with this partnership. We appreciate it. So we have our second meeting, national meeting tomorrow. I think our first one we had about 35 or 36 people, which isn't great, but it's not bad. We have over 120 registered for tomorrow. So already, just in a couple of months, the momentum is building. Commissioner McDonald, your role as a medical doctor is really critical to the discussion, and you provided some really important advice and guidance. But what medical advice do you have for people concerned about sepsis, or how you would recommend, again, because I don't think it's something we can underscore enough, how people like you can be and should be approached in order to address sepsis?
Yeah, I think when you think about how do you prevent sepsis, first thing I would just remind people is get all your vaccines. There were common diseases that early in my career don't exist anymore to any measurable number because the vaccines work so well. So I think that's one important thing we do to prevent. I think another thing is just make sure if you have a wound, you clean it right away. That's an important concept as well. I think another concept, though, is like, just say you're sick. You went to the doctor, you got treated for something, it was an infection, and it's getting worse. If something's getting worse, if you have an infection that's getting worse, check back in with your healthcare provider saying, could this be sepsis? You got to use your voice to the extent that you can. And sometimes by asking people, could this be sepsis? It really triggers their mind to say, hey, am I thinking about the right thing in particular? And I think one of the things we have to think about is, like, when you're in the healthcare experience, not everybody feels comfortable, but it's important there, again, just to use your voice as loud as you can in a respectful way, just to say, could it be sepsis? So people don't ignore you. And I think those are just a few simple things that people can do.
Yeah, and I think simpler the better. That's great advice. So I appreciate that. We're coming into that time of year that I know most older adults throughout the country absolutely love, and that's Medicare open enrollment. I actually don't really love that time of year. We have health insurance counselors that are state certified that help individuals choose the right plan for them. We don't want people calling the slick advertising numbers that you're going to see bombarded on your TV every day. But what if I could tell you that you could put almost $7,000 every year back in your Social Security check? You want to know how? Check this out.
The Medicare Savings Program, or MSP, could save you up to $7,000 annually. Hi, I'm Heather Leddick with New York's Health Insurance Information, Counseling, and Assistance Program, also known as HICAP, here at the New York State Office for the Aging. New York State recently expanded the MSP to include higher income limits in 2023. What does this mean? You and approximately 300,000 other New Yorkers may be newly eligible for this assistance right now. If your income falls within the levels on your screen, please apply today. If your income is just above these numbers, still consider applying. You may be paying for out-of-pocket costs that can be deducted from your gross income to make you eligible. Free, objective, statewide assistance is also available to help you in the application process through HICAP. Simply call the statewide helpline at 1-800-701-0501.
Thank you so much, Heather. And we'll be doing a lot more over the course of October, both on MSP and on getting ready for open enrollment and HICAP throughout New York State. So why don't we get to some audience question and answers for this great panel that we have. Alex? All right, while we're waiting, I'll ask you guys one. If someone gets sepsis, are they more likely to have it happen to them again, to be repeat sepsis offenders, so to speak?
Yeah, we just did a survey of 3,000 sepsis survivors, and it was pretty remarkable. It's on our website now, the full report on the study, but more than half had been hospitalized more than 3 times. And I think about 15% were hospitalized 5 times. So clearly there's something happening, and I'll defer to the doctor, but perhaps there's damage to your immune system. You are in a weakened state thereafter. There's probably a lot we still don't know about this, but we also see that many of those folks were unable to return to work for a month, 6 months, a year. Some never were able to return to work. So there really is a component of long sepsis that we need to think about. This is not just an acute condition, but it's actually taking the form of a chronic condition more and more as we learn more about it. And I think it's a new way to look at it as something that can very often be chronic in at least half of folks who survive.
Dr. McDonald, did you want to add to that, or good?
I think we're good. I'd love to do some more questions, though.
Okay. Is there a blood test to detect sepsis? And if you are not able to get to a doctor appointment right away, what should you do?
Yeah, could I take that one?
Absolutely.
Yeah, so there really isn't one blood test that detects sepsis. There's several that point you in that direction, right? So like a complete blood count is something you routinely get when you're evaluated for an infection, but your white count might be elevated very high. But there's other blood tests like a CRP and a SED rate, inflammation markers that would really point in that direction. These tests are available right away. In other words, you can get the results usually within half an hour or so, a little bit longer sometimes. Other tests take longer, something called a blood culture, where they actually culture your blood, take some of your blood, and try to see if there's a bacteria growing in it. That, will take a day or two because you actually have to see if the bacteria will grow. Is another example of a test that will point us in the right direction. But sepsis really is a test. There are tests that help us, but it's really a clinical diagnosis. Because when you see someone with sepsis, often their blood pressure is dropping, their heart's beating really fast, they've got a fever. There's other signs that their body is getting overwhelmed from the infection. So their organs, every organ's affected when you get sepsis. So there's not one particular test, but you raised the question, if you can't get a doctor appointment, right do you do? Well, then you go to an urgent care or an emergency room, and really the emergency room is well set up to address this, with treating sepsis. And I'm going to point back to Rory's regs. Hospitals are trained to evaluate this. These regulations have saved tens of thousands of lives in New York State. It's no small thing to get regs done. I really compliment the Staunton family for all the work they did in this space. But this is one of those things where if you really think it's sepsis, the emergency department doesn't see people first come, first serve on purpose. They see people on who's sickest first, but they should be able to triage you and know that you've been someone who's at risk and evaluate as soon as possible. Those are just a few thoughts, Greg.
Great. Another question, can you get sepsis more than once? And is anyone immune to sepsis?
Well, I can take that one too, but you sure can get sepsis more than once. And I can tell you as a physician, I've seen it happen to people. And you really don't get immune to sepsis unless it's a vaccine preventable disease. I gave this example earlier, Haemophilus influenza type B. It's a bacteria. Most people don't even think about it, but it was a very common infection when I was early in my career. The vaccine that's out there has done a great job getting rid of most of those cases. But people still get sepsis. I think about my own wife who had urosepsis. She had a kidney stone removed. And when the stone was being removed, it was, blocking things. There was pus building up behind it. And she had urosepsis, was in the intensive care unit, had pressors, in other words, keep her blood pressure up, fluids, antibiotics. And thankfully, she recovered. But this is just an underscore of why urosepsis and sepsis in general is such a personal issue for me. It's something that is life-threatening, and thankfully my wife survived from it.
Yeah, thank God.
Greg?
Yeah.
Just follow up. So when you look at the readmission rate of individuals who go back to the hospital after having had sepsis in the hospital, they're very, very high. And then I think that speaks to the point of the recurrence and the vulnerability of the patient too. It's in fact the number one cause of 30-day readmissions, which is, again, why we are so emphatic about this in home care, one of the reasons. The other thing I'd like to say about recurrence, we have two consumer advisors who are sepsis survivors who work with us and advise. One is a young woman who has recurrent sepsis multiple times during the year. She is a chronic home care patient because of the monitoring of the condition, and she is fed with a PICC line. So that line is the source of infection, and she's a great self-advocate. She's a great advisor to us, but I think it's important to appreciate the fact that this is something that can recur and recur and recur.
Yeah, no, that's a great point. I got one more question for any or all of you. I think the general public has moved on from COVID, but COVID hasn't moved on from us. There's spikes all over the United States. I think New York has the lowest spike of any state, which I think is fantastic. But can sepsis be caused by other conditions like COVID-19 or RSV, or is there some type of link between the two?
Yeah, maybe I could start with that one, Greg, if you don't mind. But certainly, sepsis is usually caused by a bacteria, but can be caused by viruses and even funguses. But certainly, COVID doesn't usually cause sepsis, but it can. But there's other viruses that do cause sepsis. I'm an old pediatrician. I've seen enterovirus cause sepsis. And, those sepsis cases don't respond to antibiotics. We still have other ways of helping people, though. In other words, sometimes we use medicines like dopamine to support their blood pressure. We give people extra fluids. We do things in our intensive care units to help people get through sepsis. But it just underscores you should prevent what you can prevent, right? I don't have a vaccine for every disease out there, but I do have one for flu. I have one for COVID. I have one for RSV. And if you're 65 or older, you're high risk for any one of those three. Highly recommend you do what I do, which is make sure you're up to date in your vaccines.
Absolutely. I'm glad you reiterated that point. Tom?
Yeah, I'll say there's research out from the CDC yesterday or today that should be eye-opening. Last flu season, we lost 200 children. Of those, 199 were not vaccinated, even though they were eligible.
Oh, wow.
So if that doesn't, sober us up about the power of vaccinations, I don't know what will.
I hear you. Well, I cannot thank the four of you enough. We're going to continue collectively to expand the message, but this is really, really important. So I want to thank Dr. McDonald from the New York State Department of Health, Al Cardillo, Home Care Association of New York, Tom Heyman, the Sepsis Alliance, Becky Prevey, the Association on Aging in New York. There's a lot of resources here. I think you got a lot of simple tips of how to identify what the signs and symptoms are. Take this seriously. As I said, just in the time we had this show today, 40 people died of sepsis, and it's preventable through infection or preventing an infection, but also some of the clear and simple tips and what you need to say if infection gets worse or you have any of those signs and symptoms. Take it very, very seriously. So again, I want to thank you all. As always, I want to thank Alex, Darren, and Roger from our Communications Bureau for making these productions just as outstanding as they are. We'll be back in October for fall and injury prevention, which is critically important, as well as open enrollment. So once again, thank you for spending the time with us. Share this with any and everybody that you can, and we'll see you in a couple of weeks.
Live with Greg is a production of the New York State Office for the Aging Communications Bureau. Please join us next time.